Hey everyone, I'm Dr. Mitchell at Ankle and Foot Centers of Tennessee, and today I'm going to talk to you about bunions. A bunion is a bump, is what most people see on the inside of their big toe joint, and really it is a shift in the position of the bones of the foot. So what we see is one of the bones, the first metatarsal, starts to move, and then the big toe moves in the direction of the other toes, and all of a sudden we have a big bump and things are malaligned. When this happens, people present to us with pain. They have pain in the big toe joint. They have difficulty wearing shoes. They can have swelling and redness on the inside of the big toe joint. And it can significantly impact their physical activities. Treatments for bunions usually involves simple things at first. For example, wearing wider shoes, getting shoes with a wider toe box. Specifically, certain shoes like a brand called Ultra is an athletic shoe with a wide toe box. I love to recommend those for people with painful bunions. But also other little things like silicone gel sleeves that you can put over the bump just to sort of cushion it and protect it. When those things fail, those simple things fail, really our only option to fix a bunion is surgery. And when we talk about surgery for bunion correction, it's all tailored to a specific type of bunion. So they're not all created equal. We make a decision on the procedure that we choose specifically for that patient's deformity. When we talk about bunion surgery and the different types of procedures, we really have it narrowed down to basically 3 procedures or 3 surgical options for correcting a bunion. Number 1 would be a newer technique that we have mastered here at Ankle and Foot Centers of Tennessee, which is a minimally invasive bunionectomy. The nice thing about minimally invasive is it's a faster recovery, tiny incisions, less pain, less scarring, and the outcomes are incredible. But there are only certain bunions that really qualify for a minimally invasive bunionectomy. Option number 2 would be a lapidus bunionectomy. Lapidus bunionectomy is a slightly longer healing process. It's a guaranteed correction of the bunion deformity, and it also addresses and fixes some hypermobility issues. And that's really what we use the lapidus bunionectomy for, is a situation where there's hypermobility. Option number 3 would be a fusion of the big toe joint. And I know it sounds crazy to fuse the big toe joint, but people do great with the big toe joint fusion. And we really use this for our most severe bunions and also bunions that involve a significant amount of arthritis in the big toe joint. So those are our 3 options. Now I'm going to talk a little bit about the post-op protocol for the procedures that I just mentioned. There really are 2 different post-operative protocols. When we talk about the minimally invasive bunionectomy post-op protocol, you can be weight-bearing immediately. You're in a boot. You're in that boot for 4 weeks, keeping most of your weight to the heel, but at 4 weeks post-op, then you can transition into an athletic shoe. And it takes the bones about 2 to 3 months to fully heal. But at 2 months post-op, you can expect to start to ramp up your physical activity, exercising, getting back into sports, things like that. When it comes to the lapidus bunionectomy and the big toe joint fusion, with that procedure, I do recommend people use a knee scooter for the first 4 weeks. They're in a boot. You can take the boot off to sleep and things like that. You can use your heel to transfer to and from the toilet and in and out of the bed. You can use your heel, that's okay, but you're not fully weight bearing for the first 4 weeks. At 4 weeks post-op, you can transition a full weight bearing and then you're in the boot for an additional 4 weeks, full weight bearing until 8 weeks post-op. At 8 weeks post-op, then you're looking to transition into a regular shoe. And we take x-rays along the way, and we see you in the office to make sure everything's healing properly and that you're hitting those post-op milestones. If you feel like you may be suffering with a bunion, please feel free to come see me or any of our providers here at Ankle and Foot Centers of Tennessee. We are accessible on our website. You can make an appointment straight through our website. Thank you.